Comments with respect to where we are.
Well, like the senator from Texas and the senator from South Carolina and my senior senator from Georgia, we all represent the people that vote for us. And in reference to your question about popularity and about the way people feel about this legislation, I'd like to ask unanimous consent to introduce into the record two letters, one from the Medical Association of Georgia and one from a consolidated group of medical associations representing 92,000 physicians.
Without objection.
And I want to tell you what these letters say. The first one is to me from President Gary C. Richter, the president of the Georgia Medical Association of Georgia, who writes in great detail about the difficulties and the problems that they have with this legislation, beginning with its stonewall against tort reform by only putting in a demonstration project, and the senator from Texas is aware of what tort reform can do because his state has made a great improvement in medical malpractice costs because of tort reform, and we in Georgia have tried to experience the same type of thing. There are, but many other reasons in here as well. And the interesting thing about the letter from the 92,000 physicians represented by their medical associations, they talk not only about what's in the bill, but what's not in the bill. And I want to read, if I can, one paragraph to demonstrate that point. Our concerns about this legislation also extend to what is not in the bill. The right to privacy contract is a touchstone of American freedom and liberty. Patients should have the right to choose their doctor and enter into agreements for the fees and for those services without penalty. Current Medicare patients are denied that right. By guaranteeing all patients the right to privately contract with their physicians without penalty, patients will have the greater access to the physicians and the government will have budget certainty. Nothing in the Patient Protection Affordable Care Act addresses those fundamental tenets which we believe are essential components of real health system reform. That's a pretty strong statement from 92,000 American physicians about this particular piece of legislation. And to follow up on the point made by the distinguished senator from South Carolina, I've got a vested interest. I just got my Medicare card. December 1st, I became Medicare eligible. So when you talk about cutting $470 billion, it gets personal. It gets personal with all those other seniors. And think about this. Seniors in America have paid their entire lives, or at least since 1966 when Medicare was created, have paid a tax, and their employers have paid a payroll tax to go into a trust fund to pay for their health care after they're 65 years old. We're now basically saying, Senator from South Carolina, we're going to take $470 billion of the tax money you have paid over years of your work, and we're going to put it in a plan to pay for somebody else's health care. I mean, that's basically what it does. And that's patently wrong. One other thing I want to mention that is critical to me, there's been a lot, and you know, we are all professionals at what we do. We all argue from our point of view, and I understand that and respect that. But something was said earlier today which brought me to have a flashback to kind of make a point about how much we've tried on this side to contribute to improvements in health care and better access for all. The very distinguished Majority Whip commented that he had talked to some realtors and that 1 in 3 and 4 realtors were uninsured and this bill was going to help them. What's interesting is the reason 3 and 4 realtors are uninsured is because they aren't able to form risk groups together associated and affiliated as a like practice. And because of the IRS code, which this does not amend, a company's employer who has independent contractors working for them cannot by law provide them with medical insurance. In 2006, on the floor of the United States Senate, 57 Republicans and Democrats offered and voted for the Associated Health Care Bill or the Small Business Access to Health Reform. 57 out of 100. We needed 60, just like this bill needed to get to cloture. That bill would have allowed associated professions to join together, compete for assurance nationwide, form risk pools that are large enough to mediate and ameliorate high rates, and have a more competitive rate. So he was correct in his statement that 3 and 4 don't have insurance. I was in that business, I know. The reason they don't is they have to buy in the spot market because they can't have a group plan. And then when they buy in the spot market, they're talking about $1,500, $1,800, $2,000 a month, which is unaffordable and unsustainable. But this bill does nothing to address that, which is one of the largest holes in the uninsured problem. In fact, when you see the estimates of those that are still left uninsured, a great many of them are going to end up being just those kind of people, independent contractors that the tax law prohibits from associating and affiliating together. And I was proud to be a part of that 57 along with the other 3 distinguished senators on the floor and a number of Democrats. There have been lots of efforts made by people on both sides to get us a better access and affordability in health care, but unfortunately, they've been blocked all over this philosophic argument of whether health care is going to be government provided or competitive in the private sector. Unfortunately, the ship of state is moving towards the government provision with this legislation, which is one of the reasons that I oppose it. And I turn it back to the distinguished senior senator from Georgia.
Well, I rise to really pose a question to you, and I would ask my colleagues to comment with respect to their state. You served in the state legislature for many years, and you're very familiar with our S-CHIP program, which is called Peach Care. You're also familiar with the rising Medicaid costs that we have seen in our state. And what this bill does in seeking to reach out, as I understand, is to expand the eligibility for Medicaid. We're all for Medicare now, but Medicaid coverage, and raises the eligibility level from 100% of poverty level to 150% of the poverty level. That's going to have a huge impact on every single state that is now going through very difficult financial times. We in Georgia have got, we had a $3 billion shortfall this past year that had to be plugged. I saw the other day in the press where we've got almost another $2 billion our legislature is going to have to deal with next month in reducing services around our state, and every state is having that same experience. But yet, what this bill does is to put a mandate on states to increase the amount of money that states put into Medicaid, and I know you're very familiar with that, and I'd ask you to comment on that.
Well, I appreciate you bringing it up. It's what's known in the trade as an unfunded mandate, and let me put some meat on that bone. The state of Georgia this year had a budget of about $17 billion, and the Medicaid portion, just the Medicaid portion, in Georgia was over $2 billion. So it's approaching, getting close to 16, 17, 18% of the entire budget. If this bill passes raising the eligibility from 100% to 150%, then in 2017, which is the trigger date on this Medicaid provision, Georgia would go from $2.15 billion to over $3.25 billion in its share of Medicaid. And at a time of declining revenues and greater pressure, that is a recipe for disaster. And our state, like 43 other states in the United States, can't borrow money. We have to have a balanced budget. And if the federal government mandates we spend $3 billion, we have to cut it out of someplace else in our state, like education, or our prisons, or our park system, or somewhere else. But you know, it's really ironic, Senator Chambliss, that you asked me that question, because this morning, as I was preparing to come over, I had the television on, and Arnold Schwarzenegger, the governor of California, was being interviewed, who endorsed this proposal originally, but raised the question that the provisions in this amendment will raise by $3 billion the cost of Medicaid just in the state of California, a state that last year had a $60 billion shortfall, and he estimates next year will have a $20 billion shortfall. If we continue in Washington to mandate funding and don't put our money behind it, we're pushing our states to the brink of bankruptcy, where a number of them already are. And it's not fair to say we're covering more people when we're bankrupting our state. We're not covering anybody if we're pushing the cost off on someone else. So I appreciate the senior senator from Georgia raising that point, and I associate myself with Governor Schwarzenegger and his remarks this morning about urging us not to force unfunded mandates on our state. Senator from Texas.
If I can respond.